Hello everybody, this is Dr. Bob DiMaria with another episode of Ask Dr. Bob. Some very interesting questions once again. And thank you for watching these and passing these on to your friends and your relatives and your co-workers. Dr. Bob, what do you think of surgery to lose weight? You know, that's a very good question. And I'm not saying there's a right or wrong answer because I know that it's helped many people. I know that people have had the surgery and afterwards weight has come back. I know there's a lot of physiology when it comes to weight loss. Most of the time it's just eating the right kind of food, but unfortunately there are so many opinions on what you should and you shouldn't be eating. You know, I promote eating vegetables and protein, keeping your blood sugar stable. It's okay to eat many times during the day, but if you eat vegetables and protein and your blood sugar stays the same, I think it'll have better long-term results, and you want to make sure that you're exercising. It's the physiology and the biochemistry that you really need to look into. You know, anytime you do any kind of surgical procedure, there will always be some kind of effects, and they're not always good effects. Just want to throw that out to you. Dr. Bob, give me your advice, please. What is the natural remedy for uterine fibroids? Well, I talk about this in Dr. Bob's Guide to Prevent Surgery. Usually, fibroids are from too much estrogen. And the estrogen is circulating in your body because your liver either cannot process it because it does not have enough B vitamins, or you're excessively exposed to estrogen. That's one of the reasons I don't promote soy products. And you just want to be aware of what you're eating. You really want to eat as much organic that you possibly can. Most of the time, if you can make it through those years, of those 40s, let's just say, and you don't have interruption of your normal daily activity with a fibroid, those fibroids will shrink once your natural estrogen level becomes lower. But being exposed to environmental estrogens creates distress. Dr. Bob, any help for bulging discs? Well, I can tell you a couple things. Biomechanically, you want to make sure the mechanics of your body are right. You know, in our practice, we take film standing up. I have found that people who smoke cigarettes and people who eat sugar have a greater chance to have bulging disc. The mechanics are off. You don't want to be overweight because when you're overweight, it compromises function and the discs have to go somewhere. Lose weight, cut back on the sugar, and see a skilled chiropractor, and I'll invite you to come into our office. We have people to come and visit us from all over the world. What is the best way to improve digestion? I have gas all the time. Watch your food combining, and I made a note about this. Let's say, and I learned this from Harvey and Marilyn Diamond like 30 years ago. Food combining. If you eat steak, for example, and you have it with a potato, that's an acid and an alkaline, and it can create digestive distress. If you're going to eat steak, for example, you have it with green beans. So that's one thought. You might not have enough digestive enzymes. Very common in women over 40 years old. Don't drink excessively with your meals. That's fluid, and that's going to be one of the bottom questions that we have. You may need a digestive enzyme like I mentioned. If you eat food and you have digestive distress immediately after the meal while you're eating, it's usually a digestive enzyme need. If you have gas an hour or two later, it's a gallbladder issue. I'd encourage you to get Dr. Bob's Guide to Prevent Surgery. It'll help you a lot. Are you familiar with something called POTS? POTS is postural orthostatic tachycardia syndrome. What does that mean? That means when you stand up, your heart starts to race. We have found that to be very common with adrenal fatigue. Have your blood pressure taken sitting and then standing. Minerals and B vitamins will help that. Avoid sugar, avoid fruit. Years ago I read a lot of books about adrenal fatigue. That's one of the reasons I don't promote fruit. Dr. Bob, you talk about not drinking water with meals. When's the best time you take your meds and supplements? You know, I take a lot of my products first thing in the morning before I even eat, before I even come to the office. And I really don't drink fluids with meals. Last question. What causes puffy eyes, and then can they be cured? Puffy eyes are also very interesting. Sometimes it could be kidney distress, not enough protein, not enough minerals. I would bounce on a ball. Very common question with ladies. I know that especially as you mature and your skin starts to change and you have extra fluid. I've also seen it with a histamine reaction. I'm learning more and more about histamine. I briefly talked about that in the past. There's something called the antihistamine factor. So there could be very many reasons. Drink water, eat protein, bounce on the ball. That will help tremendously. Very good questions. I'm Dr. Bob DeMaria.